let's get started. I have a video question, and this one is from Claire, and I can relate with Claire, and she is wondering about when her natural fertility will wane. Let's listen in.
Hi, my name is Claire. I'm in my early 30s, and I am thinking about turning 35 and wondering if there is a drop off in fertility at 35 or if it's more of a gradual thing and there's nothing really to be too much worried about. Thank you.
Thank you, Claire. Great question. And by the way, I'm not in my 30s, but I remember being in my 30s and wondering the same thing. So, doctor, what would you say to Claire? And I know she's talking about that biological clock, if you will.
So that biological clock, such thing of stating that at age 35, the fertility potential of a given woman is impaired, is, in my opinion and many people's opinion, it's a metaphor because you can't state a specific age in where fertility is going to decline. Every woman has a different biological clock, quote unquote. And that can be at age 35, could be even at age 30, depending on the patient's issues. There are some women who present with ovulatory dysfunction that starts early in life as a result of premature menopause. And those women, of course, have an impaired fertility. But if you are a healthy woman who has regular cycles and does not have any underlying medical condition, that number of 35 is not a real number. There are women who can have children way beyond that age. And of course, we have the tools to help them. So again, to answer the question, at age 30, I wouldn't worry too much about it. Peak fertility in the United States for women is at age 23. So you're not too far out. And what I would do is just monitor yourself and make sure you keep healthy. And then if there is any issues, you can always visit a physician.
And obviously, doctor, like you said, every woman is different. So does it have to do with what you just said, menopause, premenopause? Is that when it's game over?
I wouldn't call it game over when you are again at age 35. If you have premature menopause, if you have premature ovarian failure, what called premature losing of your eggs in your ovaries, then the situation, of course, is serious, and then that requires assistance from a specialist. But in general, we have now so many tools, Olga, to help patients that nowadays, age 35, again, as I said, is a metaphor for the beginning of the decline in the fertility for that given patient. You always have to keep in mind that women are born with all the eggs they will have in their lives, and as they begin to age and then reach this so quote unquote age of 35, then one has to be mindful that the number of eggs are declining, and the fertility in turn will decline as well.
And I do want Claire to know that I had my first daughter at 35, a healthy young girl. And I did have some issues as well, which I'll talk about it later on throughout the show. But I'd never mind telling people that because I was just as concerned as Claire, doctor. And I felt like, the clock was ticking, game over. But no, I think it's a myth. And there's time. There's time.
Absolutely. That doesn't mean that you have to be kind of lackadaisical about it. So you definitely you have to be mindful that, of course, you are at 35. And then as you get older than that, your eggs are going to begin to decline furthermore. And there could be another associated factors. So it is quite important to keep in mind. But certainly, like you said, and in your case, you're a good example, Olga, fertility doesn't end at age 35.
Absolutely not, because I had my second daughter at 37. But moving on now, let's not talk about me the whole show. Doctor, by the way, do men have a biological clock? I'm just curious.
I'm sure that there is, but however, it's not as clear as it is in women. So men are luckier, if you will, in that sense. And there are men who produce sperm and have normal ejaculation way beyond their 70s. So I don't think that there is a specific, again, date for age for a man to be infertile, but we have to keep in mind that there are some issues that appear later in life as men age, such as ejaculatory dysfunction, losing of testicular function, problems with premature ejaculation that can impair fertility. but there is no specific age for a male not to be able to produce sperm and ejaculate.
Doctor, let's then talk about when a man and a woman obviously want to create a family and time is passing and obviously maybe they're not getting pregnant. When does the couple actually know that, okay, there may be an issue here, or when should they say, we need to maybe see somebody because something's not happening? How's that?
Okay, that's a very nice question. Very good. Normally, you become infertile, at least based on publications, that a woman has been trying to conceive, a couple has been trying to conceive for a complete year prior to age 35. That's considered primary infertility. Beyond 35, we don't wait that long. We begin evaluate the patient at 6 months of unprotected sex, unprotected intercourse. So I think that that's an important concept that people should know. But what are the most important telltale signs that something might not be right? Of course, ovulatory problems. A woman normally ovulates once a month. And if there are issues with that and the patient has either short cycles or too long cycles, or there are other conditions that can lead to ovulatory problems, that's something that the patient definitely should investigate, because that's a cause of infertility. Some other issues as well. It could be problems with prior surgeries that might lead to scar tissue in the belly, or problems with the fallopian tubes that may obstruct them and then cause infertility. Women who have the onset of ovarian dysfunction, ovarian failure. So those are things that I think should be evaluated.